Right, well, our next presenter is someone familiar to pretty much all of us. It's Alix Chadwell, and she'll be presenting on our Fit for Purpose prosthetics project. Thanks, Alix.
Hi everyone, I'm Alix. I'm a postdoctoral researcher and a medical engineer working in the field of upper limb prosthetics here at the University of Salford. The presentation that I'm about to give is going to be a little bit different, as I'm going to be touching on lots of different areas and giving you an overview of some of the work that we've been undertaking as part of this Global Challenges grant to develop fit for purpose upper limb prostheses. Following on from this talk, we've got talks from both Mick and Kenneth, who will be giving a more detailed insight into two of the specific areas of this project. So the project is funded by the government's Global Challenges Research Fund through the EPSRC and the NIHR. It takes a fresh look at active body-powered or adjustable passive upper limb prostheses in order to develop a prosthesis which is suitable for the needs of those users who are living in low-resource settings. Further, we're aiming for this device to be able to be manufactured and repaired locally. So as I go through this talk, you'll also see that our research has raised several questions around prosthesis provision and improvements to training and to supply chains. There were two main catalysts for this research. We noted that within low resource settings, access to upper limb prostheses can be quite difficult. And further, we noted that body power prostheses have developed very little over the past 60 plus years, with research efforts being focused on externally powered devices, which are impractical in some of these low resource communities. So the team itself is made up of researchers from 4 UK universities. So we've got Salford, UCL, Southampton and Portsmouth, plus the University of Jordan and UKRI University in Uganda. The project is led from Salford by Professor Lawrence Kenny, and he's supported here by 4 researchers and 3 PhD students. And 2 of those PhD students are Ugandans who are on a distance learning programme and are co-supervised from UKRI. And then the rest of the team is made up of engineers. We've got computer scientists, prosthetists, there's a surgeon, a materials scientist and a psychologist. So to understand about the user needs and the provisions within each country, we initially undertook some week-long scoping visits, and these highlighted that the state of prosthetics provision within Uganda was quite poor, and that in Jordan there was a need for improvements to training. Louise Ackers runs a charity called Knowledge for Change, and that provides elective placement opportunities and exchange programmes within healthcare between the UK and Uganda. And we've therefore also had reports from several undergraduate prosthetists and some clinical scientists who've been out to Uganda to find out more about the state of the workshops, some of the devices that are available and the facilities and materials that are available to manufacture locally. And we've also had several visits from groups of Ugandan clinicians on Commonwealth fellowships who've been placed here at Salford for several months. And all of these opportunities for discussion have been invaluable to the wider project, feeding into all of the work packages. We've also got Maggie Donovan-Hall, who's based at Southampton, and she's led a more structured interview-based study. So she went out to both Jordan and Uganda to train the local teams in qualitative interview techniques. And that also feeds into some of the capacity building aspects of this project. So you can find some of the content of those scoping reports in a report that was presented to the WHO last summer. And we've also had some members of the team who are currently putting together some lived experience papers based on the structured interview data. So hopefully they'll be published sort of early next year or towards next year. In Uganda, unfortunately, very few people have access to upper limb prostheses. And additionally, some of the donations that are received from charities and NGOs are not fit for purpose. They may be inappropriately coloured, it might be that they're poorly fitting, they might be unable to be repaired within the country. And on top of this, in both Uganda and Jordan, it can be very expensive to import cosmetic gloves. And that can be problematic when the base hand is often an off yellow or a pinky colour, so it stands out against the person's natural skin colour. And then beyond all these limitations of cost, supply chain and the inappropriateness of some of the technologies, there are also restrictions with respect to the location of the clinical centres and the requirement for people to travel or to stay away from home. Consequently, with many of these people unable to access upper limb prostheses, their limb absence is often quite difficult for them to hide, and this leaves the person open to negative behaviours from others within their community. And in Uganda, the lack of this functional restoration has been seen to impact their ability to work, and that's crucial for many of these people. So whilst we've been exploring the user needs in these countries, we've continually encountered this discussion around making the disability less visible. Therefore, one of the key requirements is the desire for the prosthesis to look like a hand, and for some people to just be a direct replacement. Now, the human hand is extremely complex and difficult to replicate. Designers often have to deal with a trade-off between functionality and aesthetics. And further, with limitations on material availability and the cost of materials, it can be very difficult to produce something in a low resource setting that looks just like a human hand. And this in turn can lead to aspects such as the uncanny valley phenomenon, where if something looks almost real but not quite, people start to find it a little bit creepy. Additionally, this project has been particularly interesting as many of the people we've been interviewing, especially in Uganda, may have no experience of a prosthesis upon which to base any feedback. And that adds an additional challenge for myself and my other colleagues in the design team. So we're currently developing a study with colleagues at Portsmouth and UKRI to further explore the requirements of Ugandan users. So we'll assess devices from both ends of the spectrum, so something that looks like a hand but is completely passive, and a device which does not look like a hand but is very, very functional. And then we're also currently designing a middle ground to go in there. And the tasks that we're going to use to assess the suitability of these devices are based on activities which have been identified by people with upper limb absence in Uganda. For example, tasks like carrying a jerry can or cooking and washing. And with this, we have to also consider the cultural differences. For example, washing clothes is often done by hand in Uganda, with the requirement to hold the soap and scrub the clothes. And then cooking may involve actually carrying the stove around and lighting matches. So to highlight a bit more of the work which myself and my colleagues at Salford have been leading over the past few years, we've explored several areas of the design of the prosthesis, including harnessing for body-powered prostheses. We've developed methods by which we can measure the restriction that the suspension or control harness places on the user's workspace. And on average, in our pilot work in anatomically intact subjects using a prosthesis simulator, it was suggested that the participants' reachable workspace was reduced by 30% when they were using the harness. Although in the worst case scenario, as you can see in these models here, the reduction was as much as 62%. Additionally, participants were only able to achieve the full mechanical range of motion of the prehensor, so opening it and closing it, in 9% of the assessed postures. In 38% of the postures, they were able to achieve less than 50% of the potential range of motion. So for a voluntary opening device, these findings could result in a user being unable to close the hand around their shirt material when they're doing up buttons, or to close around their harness shoulder strap in order to adjust it. For a voluntary closing device, they might find themselves crushing their food as they reach towards their mouth, or be unable to grasp the material of their trousers. So following on from this early work, we've got John, who's chairing, and Mohammed, who are two of the prosthetists on the team, are developing training tools relating to this harness setup. We've also been exploring passive adjustable hands. So we've undertaken evaluation of the self-grasping hand, which was developed at the Technical University of Delft in the Netherlands. And this research has involved both real-world use by prosthesis users in collaboration with some people in Monash in Australia, and also a lab-based study to explore the reliance on the contralateral hand during operation of the grasping and releasing functions. We're now working to design a new prosthetic hand based off the force adjustment concepts of the TRS JAWS prosthesis, where the vector direction that the spring force acts in is changed in order to affect the resulting grip force. And then we're also undertaking development of an open frame adjustable socket, which Mick is about to tell you a lot more about, and we're exploring wrist design. So just to wrap up, following the success of this research project, some of the team behind Fit for Purpose recently received a new grant to promote universal health coverage for amputees through social enterprise and engineering innovation, and that's led by Robert at UKRI. This project will build on the work that we've begun in Uganda, so characterising prosthetic services, piloting a public-private partnership approach, lots of P's there, to prosthetic services, mapping the clinical need, exploring how novel, locally repairable devices could be introduced into a Ugandan setting, and modelling the potential impact. And as you can see from all of this, the positive impact that these research projects are having goes beyond the development of new technologies. The team is proposing several actions, including better data on the extent of the need, governments committing to working with NGOs and others to set up properly financed and integrated services, developing appropriate technologies to be delivered by these services, whilst also improving regional manufacturing and supply chains. So thank you very much. That's all from me. If there are any questions.
Thanks very much, Alex. That was a really nice overview of the Fit for Purpose project. So we're going to go to John now, who knows this project inside and out.
Yeah, I probably, and do you know what, this is probably the hardest one to ask questions on, because we speak about it all the time. But I think one of the interesting things that jumps out for me from this is you're talking, Alex, about the importance of understanding culture, of understanding people's views, and using those views to form an approach and develop some of the ideas for designs that are going to be fit for purpose, as the project says. I'm thinking about some of the things we've already done here, and I don't really recall us really doing too much of this. And what I'm really interested in is how applicable it might be to take your almost model that you're doing for Uganda, Jordan, and maybe translating it elsewhere, and whether that's something that you could see, you know, as we move towards perhaps the end of the project, something that could be used, you know, in other countries.
Yeah, no, I can see that as quite a reasonable approach. I think it's been quite important to include the PPI work and trying to understand what it is that the users are requiring. I think that's a key bit that goes into any project in terms of understanding the local needs. And then in terms of the way and the approach we've taken to design, I think that's easily something that can translate. And part of the design work we're doing, the hope is that, yes, although this is focused on Uganda and on Jordan, that hopefully these kind of concepts could be moved elsewhere longer term as well. Yeah,
because I'm thinking, I know Kathy talked initially about some issues with ISPO, but I'm thinking this, you know, these are discussions that could be had more widely about how we could you know, use some information, as I say, from the ground and work towards developing better systems. You rightly talked about the harness. I'm sure there are other aspects that we can work on as well. So yeah, a really interesting project. I know, as I say, it's sort of coming to the end, but I think in many ways we are opening up other doors that hopefully we can use to further the cause and to better prostheses for people across the world. So thank you very much, Alex. That was really nice. Another really good presentation on that project.
Well, thank you.